Hello and kumusta? In this session, we will talk about a model of practice entitled Ecology of Human Performance. This model was conceptualized by Winnie Dunn, Linda McLean, Katana Brown, and Mary Jane Youngstrom. So, from the perspective, my experience on this as an occupational therapist, when I was working in a neuro-oncology facility, I was assigned a client. I was looking after a client who had cancer and was terminal. He's elderly, was living with his wife. They were both living in a flat. They didn't have any children, so it was just the two of them. During my training as an occupational therapist, I had a strong foundation on the rehabilitation models and most of the frames of references. And I am aware of the models, the popular models that are out at the time. Particularly, it was model of human occupation and Canadian model of occupational performance. And when I was asked to do a case study of this person who had a cancer, everything that I have done didn't feel like it fits in any model. I'll tell you why. This is because when I looked after him, I arranged for him to go to have carers. I arranged to give a commode. I arranged to give a hoist. Nothing in there that I did was a fits the model of rehabilitation, or I didn't address their routines or habits, and I didn't do the values, the interest, and the personal causation part of things, because I was working in an acute hospital and my objective was to get the person out as soon and as safe as possible. So the question for me was, what was this model of practice? What was the model of practice that is best suited to the case? So I did a lot of digging and I came across this model, and it's called Ecology of Human Performance. And this is what we're going to talk about now. Ecology of human performance, the fundamental framework here is the belief that ecology, or the interaction between a person and the context, affects human behavior and their task performance. So it just means that human performance is a transactional process in which the person, the context, and the task performance affect one another. Each transaction affects the person's future, their performance range and options, because the person, the context, and the available performance range may be modified by experience. So, in this model, the therapeutic intervention from the ecology of human performance perspective occurs when there is a collaboration between the person, the family, and the occupational therapy practitioner. So this is really good because every time you go and speak with the person and the family, then that's it, an OT intervention is already taking place. Occupational therapy intervention is designed to enhance the person's performance by changing the variables, and you either change the person, you either change the context, you change the task, or the transaction that's happening between the person and the task. Let's talk about the assumptions of this model. So, a person and their contexts are unique and are dynamic. So, every individual is unique, meaning there's no two cases are the same. Another assumption is that the contrived contexts are different from natural contexts. What are the contrived contexts? Contrived contexts are situations that have taken place that is out of the natural context. So the natural context is the person's environment, technically. So that's the natural context. But the contrived context is a different environment. like a hospital, for example, or an acute situation. That is a contrived context. Another assumption is that occupational therapy practice involves promoting self determination and inclusion of persons with disabilities in all contexts. So it doesn't matter if a person is fit and able or person has a disability. It's very inclusive. And then the last of the assumption is that independence includes using contextual supports to meet the person's wants and needs. So, in this framework, when you provide something like a personal support, a PA, for example, so a personal assistant to a person with learning disability or a young child with physical disability. So, putting on a PA, setting a PA, and there is a support in there, that is still considered as a person being independent. Now let's talk about some of the definition. So there are few terminologies in here. Person. So the person is the individual with the unique configuration of their abilities, experiences, sensory, motor, cognitive, psychosocial needs. Persons are unique and complex, therefore, precise predictability about their performance is impossible. The meaning of a person attaches to task, and the contextual variables strongly influence the performance. So, what is this saying? The meaning a person attaches to the task and the contextual variables strongly influences the performance. Okay. Task, by definition, may be considered an objective set of behaviors necessary to accomplish a goal. It is an infinite variety of tasks exists for every person, and roles will shape a person's task. Performance is comprised of both the process and the result of the person interacting with the context to engage in tasks. Performance range is determined by the transaction between the person and the context. So, and lastly, the context. What is the context? Context has two aspects. It has the temporal and environmental contexts. Although temporal contexts are determined by the person, temporal features become contextual because of the social and cultural meaning attached to them. So, going back to the case that I was talking to you earlier on, in a nutshell, the person is really able to do the things that they're able to do only if the context is allowing them to do it. What are these contexts? There are two contexts. There are temporal contexts, okay, and then there are environmental contexts as well. So the temporal context that we are forgetting are these. Number one is the chronological age of the person. So a person will be able to do the things that they're doing depending on the limits of their chronological age. Another temporal context is the person's developmental age or their phase of maturation. So, for example, a person who is 40 years old chronologically but is performing at a 2-year-old physical abilities and cognitive abilities. So it means that their context is not allowing them to do the things that what is expected of them on the level of 40 years old. So the person may not achieve independence with their toilet hygiene. That is because their chronological age is 2 years old. The other thing is life cycle or place in the important life phases such as the career cycle, parenting cycle, and educational process. So these are again contexts that affects the person. And then the one thing that I find that we're always battling with, a person is always battling with in a hospital, is this context called the disability status, or the place in the continuum of a disability, such as the acuteness of injury, the chronicity of the disability, or the terminal nature of the condition. So these are the disability status. So for the case that I was talking to you about earlier on, person who has cancer, so that is a context. The terminal nature of his condition is so close that it's limiting his ability to do his day-to-day things. Okay. So the other context that we are battling with, or that we are transacting with all the time, is the environmental context. And this can be the physical environment, which are the non-human aspect of the context. And this could include the accessibility to and the accessibility to and performance within environments, having natural terrain, are there plants, animals, buildings, furniture, objects, tools, and devices. So this is what is popular, the environmental context. Another context that is limiting us or influencing our performance is the person's social context. Okay, and social context is the availability or and expectations of significant individuals, such as spouse, the friends, the caregivers, also the larger social groups, and are influential in establishing the um, uh, the norms and the role expectations and social routines. Okay, and then the last is the cultural environment, which are customs, beliefs, activity patterns, behavior standards, and then these are the expectations that are accepted by the society of which the individual is a member of. And this include political aspects such as the laws that affect the access to resources and affirm personal rights, also opportunities for education, employment, and economic support. Okay, now going back to the case that I was talking to you about, person with a cancer. So the physical environment that is affecting him is obviously he lives in a top floor flat. There are stairs. There's no lift. Once the person is up there, I believe that's also a shower over the bath. Okay, so these are the ones that would limit his ability to engage on the day-to-day things. The social context that's limiting the person is that there's only the two of them, himself and his wife, who is also an elderly person. The wife cannot provide the help that he needed, and there's no other support. It's just the two of them. And then the customs and belief is that, I mean, they are from an Asian culture, so along with that comes with their privacy and how they value being together, just as a couple as well. Okay, so the therapeutic interventions then for these model is one that we could sum up in five categories that will take the acronym of RAMPS. R being restore. So with this model, you are allowed to restore the problem. So for example, if this person had a fracture, then all I need to do is restore the movement back. And I do that through regular practice, range of motion exercises, strengthening of the muscles, strengthening of the core. These are all restorative examples. For somebody who's had a stroke, some of the restorative interventions that you can utilize are neurodevelopmental techniques, neurodevelopmental treatment. You increase the tone. If they are confused, you reorientate them. So these are all restorative interventions. The next intervention under the acronym of RAMPS is the A stands for alter. So it means alter actual context or task in which the person will perform. And in here, therapeutic interventions can alter the context or task within the person performs. This intervention emphasizes selecting a context or a task that enables a person to perform with their current skills and abilities. And this can include placing the person in a different setting or task that more closely matches their current skills and abilities rather than changing the present setting or task to accommodate the needs. Okay, so the alter intervention is you change the actual setting. Had I recommended that I put the person into the care home, then that would be an alter intervention. Now, alter intervention is not a modify intervention. So this would be the next treatment, which would be the modify intervention. So modify or adapt the contextual features and task demands so that they support the performance in the context. So these are modify interventions. So when you modify interventions, you use different techniques, different strategies. You use adaptive aids. So modify or adapt approaches encompasses a compensatory techniques, including enhancing features to provide the cues or reducing other features to reduce distractibility, for example. These are modify techniques. So, for example, somebody has had a stroke, and the context is that they have a hemiplegia, and so and despite the context of despite the treatment of restorative treatment, and if you cannot restore that side anymore, then the person needs to learn how to put on their clothes, then you teach them one hand dressing technique. If the person has difficulty getting out of one side of the bed, you teach them to go out on the other, and you use a bed lever, for example. These are modify techniques as well. So you change the ways. If it's difficult for them to get changed and it's making them tired, you teach them how to dress sitting down. These are modify interventions. Okay. Now the fourth treatment in this model is called a intervention. And a preventative intervention is similar to restorative, and it is similar to modify intervention. The only difference is that your objective while you're doing the task is to prevent problems from taking place. And this would be like, for example, if you give a person a perching stool for the purpose of preventing the person from falling while strip washing, then that becomes a preventative intervention. Say you're doing passive stretches, knowing that the arm is not going to recover, well, why do you still do it? That's the question. If your intention is to prevent the joints from seizing up, then that intervention is considered as a preventative intervention. Okay. If the person, say, has spinal cord injury, but you do regular sit to stand, knowing that this person is not going to walk, why do you do that? If your intention is to preserve and to maintain the osteoporosis of the joints by putting weights on that, that means that approach of getting the person to have regular sit to stand practice or weight bearing using a tilt table would have been a preventative intervention. Okay. Now, the next thing would be, the last type of intervention would be support. Okay, supportive intervention, or create circumstances that promote more adaptable or complex performance in the context. So in here, Providers can also design intervention. So therapists can also design intervention that promote performance in the context. The create intervention does not assume a disability is present or that any factors would interfere with the performance. Create intervention focuses on providing enriched contextual and task experiences that will enhance the performance for all persons in the natural context of life. So when you set up the person, when you do something that will enrich, okay, the contextual and the task performance of the person, then you are doing a supportive intervention. So what will fall on this category? What activities will fall on this category? The categories of, say, when you refer a person to the community therapy team. So that act of referral is you are creating an enriched contextual support. So the act of referral becomes a supportive intervention. When you put in the carers in place, you are doing something that will enrich the person's ability to engage on the day-to-day task, and they will sustain living in that particular area. And that is also a supportive intervention. So for the case that I was talking to you about earlier on, going back to that case with the cancer patient, what I have done is I have put in, I've requested carers to come in. So those carers are supportive intervention. And I have put in moving and handling equipment like hoist. And that is, my intention is to have a backup in case he has difficulty getting from the bed to the chair. And for that purpose, I could either just, and that's from my reasoning, would be to allow the carers or to prevent the carers from having issues or having moving and handling problems. So that could have been preventative. Had the hoist was, if my intention was to, if it's to make it easier to transfer from bed to chair, then it would have been a modify intervention. Okay, but at the time it was more preventative intervention and supportive intervention at the same time. Okay, so it has two. And what I did as well is I have given a commode as well. So what did that commode do? So my intention was for a person to have access to a toilet facility in case he has difficulty going into the toilet. So that would have been a modify intervention. So what's nice about this model is that it guides a clinician about the interventions, and it's telling us that really the context is the one that is affecting the performance. It's giving us the wisdom that despite our ability to resolve everything, it's making us realize that we're not really in control, that we are dependent on circumstances, and these are contexts. And it's really nice. It's really nice because everything falls into it. Shall we have a few more case studies? Okay, let's have another case study. So for example, now I am working with somebody with lungs. Most of the time they have lung problem, and it's chronic. And so the problem is they cannot do the shopping. So if they cannot do the shopping and you educate them to shop online, so that is an education. That's a modified intervention because you adapt the ways. Okay. If we put in some stations so that the person will be able to do the things, or it will, their breathlessness will not exacerbate while performing their day-to-day task, that becomes a preventative intervention. If we put in the oxygen with the purpose of maintaining deterioration or preventing deterioration or preventing hyperkalemia, then that could have been a preventative intervention. If you give the oxygen for the purpose of improving so that the person can do the things much easier, that becomes a modified intervention. So there you go, guys. Thank you for joining us or joining me. Do me a favor, if you enjoyed this session or you learned something from it, share it with others, talk to others about it, talk to others and have this discussion, grow together. My name is Emil Magpantay. I am your occupational therapist. Just remember, everything you do matters and has an outcome. Bye.